Taking charge of your sexual health, Genie James is the CEO of Dr. Randolph's Ageless and Wellness Medical Center. Okay, so I don't know about you guys, and she's joining us obviously right now to talk a little bit, because I'm not doing this by myself, I'm just saying. So there was an interesting commercial, and I don't know if you guys at home have had the opportunity to see it, and it's really been airing a lot of recent, and it's targeting women, because we've seen a lot of those sexual dysfunction commercials that really target men. This one is more focusing towards women, and now it's getting a lot of attention because a lot of women are suffering from this, but no one's really ever wanted to say that they have, from what your experiences, as you told me, from people coming into your office. Talk about what it is, the commercial, and what you've been finding.
Actually, what it is, the product's called Osphena, and it's targeting women over 45 who are suffering from painful intercourse. When sex hurts is the tagline. And it's really a big issue. Over 40% of women over 45, today the statistics show, are reporting that they have painful intercourse, that sex hurts. And that's really interesting because 40 million Americans today are in no-sex, low-sex relationships, so painful intercourse can be a factor in that. What's really fascinating, though, is in the early 1990s, the doctors' studies show that only 1 to 3% of women said they had painful intercourse, right? And then even in 2001, it was only up to 20%. Now we're saying over 40%. So it's a big shift.
Yeah, well, why the shift, though? Why are more women more comfortable in talking about it, and commercials like this are giving women, you know, the opportunity to say, oh, I guess I'm not alone.
Right, absolutely. And it's good that they can talk about it more. We can probably thank all the ED commercials, the erectile dysfunction. I mean, who in America doesn't know what to do if an erection lasts more than 4 hours, right?
Right. Yeah.
Okay, so now women are becoming more free to talk about the issues with their own sexuality. So it's not that more women are suffering, it's that more women who are suffering are no longer suffering silently. They're talking to their doctors and medical professionals.
Yeah, not afraid to say something. Is this a true medical issue that women are suffering from, or is this like a, you know, a psychological thing, or what's going on?
Yeah, it's not in your head. It can cause issues with self-esteem and emotional, you know, despair. But really, it's a health issue. When we're talking about any woman at any age, if sex hurts, you need to see a medical professional. But what happens with women over 45 is as you move towards the menopausal years, your body can't make as much estrogen. And estrogen is good for a lot of different things, but it also helps keep the vaginal tissue firm and supple and moist. So as you lose your estrogen, you actually lubricate as well, so it becomes thinner tissue. And so sex hurts because it's painful, it's dry in there, and actually it can rip little fissures, which can cause a urinary tract infections, which are also very painful. I was actually with Pam Rama, Dr. Rama from Baptist Heartwise yesterday, and or day before yesterday, and you know, I said to her, would you say this is true or not? Because women who are low on estrogen, their heart is also at risk. So we came up with a new tagline: when your vagina is dry, your heart is at risk. So two things are going on. One's more silent than the other.
Does Dr. Rama know we're talking about her right
now? She doesn't, but I'll see her this afternoon, and I'm sure I'll hear about it.
And she's a cardiologist. She's a great lady.
She's my cardiologist.
And so here's the thing, too. You're so passionate about this and helping women through all sorts of medical issues, and that's one of the things that you guys do at your office. You even wrote a book about this, and the book is called In the Mood Again.
In the Mood Again.
This is what, your fifth book, fourth book?
Sixth book.
Sixth book. Who's counting? So when you wrote about this, what were some of the stories that you found that women were able to talk to you about and be so forthcoming?
You know, when you began to ask women, particularly one-on-one, they opened up. Many women who were having painful intercourse that sex hurt would actually start crying. It wasn't just an issue about the sex. Their whole self-esteem would suffer, their feeling of beauty, their feeling of sexuality for a lifetime. But conversely, when I talked to women 40, 50, 60, 70, and 80 who were having great sex, you know, and regular sex, they were happier, they felt more vital, but also statistics show that people who have a regular sex life through the decades are more likely to be healthy, fit, and live longer. So it's not just about that. It's good for your relationship, but it's good for your whole inside outside.
I heard that on Dr. Oz, on Oprah. I mean, they've done specials into that kind of stuff. Yes. So listen, if there's somebody who's watching right now who might find themselves that fall into this category, don't necessarily want to go to the doctor right out of the gate and talk about it, are there medications that can be used to help? How do you treat something?
That's a great question. Now, if you're considering any option, you know, we're smart women today. Do your homework. Be sure to look at any side effects that are associated with any kind of treatment. For Osphena, for instance, the side effects include stroke, blood clotting, increased risk of uterine cancer, headaches, changes in your vision and speech. I mean, it's significant. We talked about it at our clinical meeting yesterday with our 2 physicians and 4 nurse practitioners at Dr. Randolph's Ageless and Wellness Medical Center. And their concern, too, was of the great many side effects associated with drug interactions. In contrast, there's another option to consider, which is bioidentical hormone replacement. I'm 54. This is what I do. I suffer from vaginal dryness without my treatment. And I use a bioidentical hormone formulation based on my own personal lab work to make sure that I'm healthy and vital and vibrant and comfortable sexually at 54, and I hope at 84.
I am so impressed with your honesty and I'm like, it was just funny having this conversation even before we came on the air. Nick was like, are you doing this? And I'm like, no, he's not doing this. I'm doing the theater, but I want to do theater. Anyway, but you know what? It's one of those things that women really, you know, they suffer from a lot, and we like to suffer silently, no matter what it is, really.
It is.
You know, you put the whole family first, and then there are the things that could make life easier.
Right. And, you know, women don't need to suffer silently. This is a real issue. It's a medical issue, and there's safe, effective treatments, and you have options. So any woman at any age who's having painful intercourse, go see a doctor. Do your homework first and ask informed questions. And I'm going to tell you, if they're not listening to you and they sort of blow you off, you need to see somebody else, because doctors are there to listen and to be your partner in keeping you healthy and well for life.
Thank you so much, Jeannie. We appreciate you.
And we have an offer.
Yes. What's that?
The offer is if you email us at info@hormonewell.com, it's on the screen, info@hormonewell.com, the first 10 people will get a free copy of In the Mood Again. And everyone after that will also get added to our e-newsletter list, which has great information once a month.
Thank you so much.
Great to be
As always,
here.
good stuff. And thanks so much to Dr. Randolph's Ageless and Wellness Medical Center, of course, for coming on and sponsoring this segment. For more information, to make an appointment, you can check out their website, agelessandwellness.com. You can also give them the call. Numbers there on your screen, 904-249-3743.